Planned Parenthood was founded under the name American Birth Control League in 1916 when Margaret Sanger opened the first U.S. birth control clinic in Brooklyn, New York. As a result, she was temporarily imprisoned. By 1942, it became part of what is now the Planned Parenthood Federation of America. In 1970, it received federal funding when Richard Nixon signed the Family Planning Services and Population Research Act, which is based on the premise that no American woman should be denied access to family planning assistance because of her economic condition. Today, it's still as controversial as it was in the 1900s. Recently, the main controversy has been surrounding the concept of funding. There's also been talk of abortion in relation to Planned Parenthood, sparking discussion about whether it should even be publicly funded. This discussion has perpetuated contradictory information about Planned Parenthood as an institution. We asked around campus to shed light on these misconceptions.
Counseling on abortion, unfortunately.
Birth control, like teen pregnancy, like if you want to give your baby up for adoption.
Birth control pills?
There's adoption, abortion, keeping the baby, but also providing free protection and tips on birth control.
Like birth control, pregnancy, if you're a teenager and don't want to go to your parents.
STD testing.
Contraception.
Like safe abortion services.
Give Plan B out. They can do birth control.
They give free or like at least very discounted abortions.
I also know that they provide like free or reduced birth control options.
When someone thinks they're pregnant, it's a great place to go to. Certainly contraceptive advice, and I think supply it as well whenever possible. And also particularly reach people who probably cannot afford to get those services as well.
So what's the truth? Their largest service is STI testing and treatment, which was only listed by 1 out of our 20 interviewees, followed by the extremely popular response of contraceptives at 33.5%. Cancer screening and prevention, which wasn't mentioned at all, is about 15% of their total services. The final 13.5% goes toward pregnancy testing, prenatal services, abortion procedures, family practice services, and adoption referrals to other agencies.
Less than 10%.
That's about 40%.
I'd say 10%.
Probably relatively small.
Too much. Slim to none.
10%.
So what's the truth? While abortion is their most controversial service, it also takes up the smallest percentage of Planned Parenthood services at only 3%.
I don't know where all of it comes from, but there's a good portion I think comes from the government.
Probably like they have fundraisers or they ask for donations. Like I doubt like any of it comes from the government.
I guess it's the government.
It is not through federal funds, but also through donations alike, which I have done in the past.
I don't know. Taxes.
No, it is not federal, state, or local funding. Most likely probably donors.
I guess my first guess would be government funding.
Government, and I think some people pay for their services like at a discounted fee or insurance.
I know that the government definitely funds them quite a bit.
Taxpayer money.
So what's the truth? Contrary to our interviewees' assertions, there is absolutely no government or federal funding of abortions. Title X, a federal grant program to help low-income and uninsured people access sexual health care, does not fund abortions. The Hyde Amendment of 1976 makes government funding of abortion illegal. Planned Parenthood receives almost half its funding from the government, but none of it can be allocated to their abortion services. That means it's not with your tax dollars. Perhaps the most compelling argument for defunding has to do with the concept of fungibility. Opponents of public funding argue that government funds allow Planned Parenthood to allocate the majority of private donations to abortion procedures. If government funding were reduced or eliminated, many of those private donations would go toward non-abortion medical services and drastically reduce the amount of abortion procedures Planned Parenthood is fiscally able to provide.
I would say regular schools maybe provide bare minimum.
I would say some hospitals have free clinics that would provide them.
Schools do it, universities.
Public hospitals do, particularly when you can't afford it, but I don't think we have enough of that, so we need Planned Parenthood.
Outside of college campus, honestly, I can't pinpoint anything other than Planned Parenthood.
So what's the truth? Many of our interviewees suggested the Student Health Center as an alternative for sexual health services. Others suggested a family doctor or a public hospital. Medicaid provides family planning services and supplies for eligible groups. However, according to Planned Parenthood's annual reports, their average patient has no health insurance or is low income. The only comprehensive alternative to Planned Parenthood is a free clinic.
I think reduced funding would be a wonderful idea, and I think less abortions would be performed.
Women would resort to more dangerous forms of abortion. Like teen moms would be left out in the cold.
More teen moms and more TV series.
I think that there would be less birth control available to students, and then you'd have a raise in abortions.
I feel like Planned Parenthood wouldn't be able to provide as much as they do to kids that want either birth control or to get an abortion.
Disastrous, particularly for those who are pregnant.
Maybe less abortions?
The women going there for safety purposes would probably resort to more dangerous places or more dangerous techniques.
People who need those services that maybe can't afford to go to a privatized doctor or a hospital, they can't use those services.
I think a lot of women, if they did decide to get an abortion, would get it illegally, and that's a huge problem.
We'd have more babies.
So what's the truth? Since Planned Parenthood's primary services are contraceptives, STD testing, and cancer screenings, fewer of those services would be freely accessible to low-income men and women. Planned Parenthood supporters argue that abortion rates would remain the same, but would be done dangerously and result in more deaths. Planned Parenthood detractors argue that abortion rates would significantly decrease. As they still receive funding, at this point it's all speculation.
No.
I have.
No.
Yes, I have.
No.
I have not. No, I haven't.
I have not been to Planned Parenthood.
No.
Most people had opinions regarding Planned Parenthood as an institution, but only 2 had ever been inside one. The average patient is a 20 to 24-year-old working woman with no health insurance. Statistics say that 1 in 5 women will go to a Planned Parenthood in their lifetime. Overall, it seemed that the only certain fact was that many people simply did not know.
I don't know.
That one I'm not sure of.
I don't know.
I don't know.
No idea.
I'm not really sure.
No idea.
I don't know.
I have no idea.
With such a hot-button controversy, we have a civic duty to be informed of the facts before taking a stance. Too often we heard, I don't know, following someone's opinion. But it's not only civilians, it's politicians muddying the waters and Planned Parenthood's silence on the facts of the matter. Senator John Kyle said, if you want an abortion, you go to Planned Parenthood, and that's well over 90% of what Planned Parenthood does, and added later that this was not intended to be a factual statement. If anything, what we need most in this discussion are factual statements. What we need is for everyone to be more informed.